How do you top that? I'm done. Well, good morning, Charlotte, and happy 207th birthday to Abraham Lincoln. Can you believe it's been 207 years since he was born? I grew up in Springfield, Illinois, so I've been to the Abraham Lincoln grave, the new museum library, which if you haven't been there, it's amazing. And when you think about Abraham Lincoln, he was a president during a period of time in America that was probably one of the worst times to be the president, during a civil war. And what's going on with our healthcare system at over $3 trillion a year, and the disease rates, how we treat disease, it's bankrupting America, it's bankrupting employers. You know, it's one of the reasons we're losing jobs to Mexico and China. We can't, as employers, can't afford the healthcare costs, you know, all the taxes, and you are the solution to that. As I mentioned in the video, it's about prevention, it's about natural solutions, and the reason I'm up here today is your management team of Maximize Living, and particularly Dr. Ben, asked me to come on stage based on a conversation that Dr. Ben and I had just a few weeks ago. We covered so many topics, it was amazing, and Dr. Ben said, well, can you come and just say all that again to my folks, and I'll give it my best shot. And he sent me a list of the topics we discussed, and we'll go through. But before we do that, I'd like to just spend a couple minutes and explain my history of why I do what I do. I grew up in Illinois. I was raised and adopted by my mother's parents, my grandparents. And what that meant was a lot of great memories, but it also meant some bad memories. As I entered my teen years, my grandparents entered their 70s. And they went from being healthy to being very unhealthy. And I remember about age 12, my grandfather started to shake, and that was Parkinson's, which sadly, to this day, there's no treatment for it. It progresses. It's a horrible disorder. They both ended up with arthritis, both heart failure, both heart attacks. My grandmother had type 2 diabetes, hypertension, a lot of awful diseases, which then led to dementia, depression. And I took him to doctor after doctor after doctor, you know, believing what I saw on TV, watching shows like Emergency in the 1970s was true, that they would be cured by these doctors, these drug companies and hospitals. And what I saw was just a disaster. I saw tons of side effects. I saw a lot of painful tests, huge bills, which now have quadrupled. In fact, I tell people, if you get the diseases today that my grandparents had many years ago, the treatments are no more effective. You're going to have the same awful outcome. The difference is you're going to get a bill that's 400% higher for the same result, and that's the truth. In fact, the last 20 years, healthcare costs have tripled, and I'm sure they've quadrupled from 25 years ago. So we've got to make some dramatic changes, and I learned a long time ago you can't trust the drug companies, you can't trust the FDA, and so that's what got me into this. I went to medical school, libraries, nights and weekends, studying, trying to find that magical drug cure, which I never found, but what I did discover was nutrition. I found all these medical journal studies published in reputable, prominent journals like British Medical Journal, New England Journal of Medicine, JAMA, you name it, and they were in humans, and they were double-blind, randomized, placebo-controlled studies. And I would take these studies to their doctors and say, why are you not giving them this herb or this vitamin or mineral? And they would laugh. In most examples, would just laugh at me and say, oh, that's just, that's not going to work. And then I realized we had a real problem. And I started looking at the formulas of most supplements sold at the stores and realized that they were not going to work. And so when I founded my prior company over 20 years ago, it was with the goal of creating supplements that would actually prevent, reverse the major health problems that your patients and that all of us will face someday if we don't maintain good health through nutrition, supplements, exercise, and of course other natural options that you offer your patients. So let's jump into the presentation here. Here we go. We mentioned healthcare costs. Look at the healthcare costs versus inflation. You know, a 3%, 5% may not sound like a lot until you compound it. When you compound 3%, 5% every year, that's where you triple over 20 years, and it's unsustainable. And what the FDA's done is they've essentially created a monopoly for mainstream medicine. And the FDA is essentially the Gestapo for the drug industry. In fact, I guess no surprise, after that CBS News investigative report aired, which the whole report is actually 2 parts in 12 minutes, and you can find it on YouTube. About 2 months after that aired, I got an IRS audit notice, first one in my life. So all that stuff you hear about how the IRS targets people, so full audit, and I'm still going through it. And I got nothing to hide, but the problem is it takes a lot of your staff's time. It costs, you have to hire an accountant to represent you, like a lawyer basically. So I'll spend thousands, tens of thousands of dollars to deal with an audit, thanks to that video, I'm sure. The FDA probably didn't like what I had to say, and the drug companies sure didn't like what I had to say. So drug costs in America, unbelievable. Depending on the drug that you look at, we pay as much as 500% more in America than other countries pay for their drugs. And if that doesn't prove that the FDA is the Gestapo, I don't know what does. And that's from monopolistic practices, basically, where they have control over our healthcare system. We mentioned $3 trillion a year on healthcare. What does $3 trillion a year mean? It's such a big number, it's hard to even comprehend it. And the total welfare spending in America, which is way too high, is $1 trillion a year. The total military defense spending is $600 billion a year. So now we spend 5 times more on healthcare than our defense. It used to be, if you go back decades ago, it was the opposite. We spent 5 times more on defense than we did our healthcare. What does that mean? That means our military has the oldest fleet of airplanes and vehicles and tanks they've ever had. The average airplane that the Air Force is flying right now is pushing 30 to 40 years old, which is a little scary. I own and fly an airplane. I love airplanes, and I got to tell you, I don't think I'd be real comfortable flying some of the B-52s that are now 50, 60 years old. That's pretty scary, and one of the reasons is they're having to spend so much on the healthcare system through Medicare, Medicaid. Oh, and then on that slide, go back here real quick. What's really shocking, what do we get for that $3 trillion a year? Life expectancy, 34th. We're 34th in the world, and we live up to like 6 years less than other countries that spend a fraction of what we do. So that tells you that drugs and surgery and these expensive tests in hospitals are not working. They're not the solution. Okay, vaccines. I've got children, so this is an issue near and dear to my heart. I've studied the issue. I've looked at both sides, and I got to tell you, I stopped doing vaccines with my kids many years ago. The evidence, in my opinion, there's more risk than reward. They're giving triple the amount of vaccines that they used to give compared to when I was a kid. And there's no question, if you look at the rates of autism and the tripling of the amount of vaccines that they're giving, they parallel each other, off the charts. The CDC, the FDA, media, they'll tell you there's no harm, they're perfectly safe. In fact, Dr. Ben Carson, running for president, medical doctor, great pediatric neurosurgeon, I'm sure. He actually lied on stage during one of the debates saying that vaccines were safe and effective as given. And the evidence does not support that. And so that's another issue that I go into Walgreens. What do you see as you walk into Walgreens? Free vaccines. It's unbelievable how they're pushing the vaccines. And the CDC was actually busted for destroying evidence of a study linking vaccines to autism. And the 2 researchers that did it, once they got caught, guess what they did? They became whistleblowers and hired a lawyer. So now they're going to probably make a bunch of money off of doing some really bad things. And the CDC, you cannot trust them. They're in bed with the drug industry. They're no better than the FDA. And it's just unbelievable how the media regurgitates their lies and does no due diligence on their own. See, how do we go forward here? There we go. Okay, testing of products. I spent millions of dollars on my lab alone with the latest next generation testing equipment that can accurately test for heavy metals to parts per trillion. We test for lead, mercury, arsenic, cadmium. We're one of the few companies that passed Prop 65, California, which requires only a half a microgram or less of lead per serving. If you go to the Prop 65 website and search lead violations, you'll find about 4,000 companies that have been violated for too much lead. We were one of the few that got a letter congratulating us where they tested about a dozen products and they all passed. The other testing we do is for microbiologicals. There's been 8,000 recalls for contamination in food products and supplements per year. Recently, Garden of Life, massive recall of their products for salmonella contamination. And what that tells me is they're not doing proper microbiological testing. We also test for actives. I decided to buy the top-selling herbs from Walgreens and Walmart and Amazon and do testing of actives. So like turmeric, the active is curcuminoids. Majority of products are coming back with 1% or less actives. Resveratrol, I tested one product that had a 2-cap per day serving, 1,200 milligrams. It was a complex. You would expect a little bit of resveratrol in that 1,200 milligrams, since that's how the product was promoted on the front as a resveratrol product. Had less than 1 milligram of resveratrol, but it was labeled at 1,200 milligrams total of a complex. So it's a major problem, and the retailers don't care. As long as they make the money, they don't care. The only one I found that has, that cares to some level that I respect is Costco, but others won't even visit my facility. The Walgreens specifically, I remember talking to their buyers, and I said, you're using non-standardized herbs that have little to no active, and they cost like $8 a kilo versus hundreds of dollars a kilo for the standardized that have high levels of actives, and they didn't care. I've met with buyers at Walmart, Sam's Club, Walgreens, CVS, you name it. They won't tour my facility, which if you don't do that, how do you know what you're getting for your customers? Maximize Living has toured my facility. They sent their whole science board, and we spent a whole day together. The only retailer that's done that actually is Costco, so I take my hat off to them. But the others don't care, and when I pointed out that the products aren't going to work based on too little actives, they didn't care. It's just unbelievable, beyond my comprehension, actually. Okay, we talked about 4,000 companies have violated too much lead in their products. Garden of Life's under a massive recall right now for obviously failing to do proper testing. When Dr. Ben and I were talking, he's such a wonderful man. You can tell he really cares deep down about his patients and all of you. He wants to do the right thing, and we got talking about our troops, our soldiers, which are some of the few government employees that we don't have enough of and that are underpaid. With others, it's the opposite. We've got too many and they're overpaid. And I looked at what soldiers are being fed, and I've got a good friend who's a captain in the Army. He's a Black Hawk pilot on his 3rd tour of Afghanistan now. And he was telling me, Wayne, they feed us awful. And then I was looking at the MREs that they give them. Per serving, per meal, over 100 grams of sugar per meal. And the studies that I've seen on sugar and high fructose corn syrup, fructose, it's as deadly to your body as smoking cigarettes. It damages your DNA to the same level as smoking cigarettes. And that's what they're feeding our soldiers, and give them no supplements. And if they did, I'm sure they'd probably give them a Centrum or a one a day made by the drug companies, which probably do more harm than good. It's a tragedy. So you wonder why so many are suffering from depression. And did you know that more soldiers die from suicide than from enemy fire? I mean, that's unbelievable when you think about it. And if you look at the disaster of the Veterans Administration, they're just like a typical hospital, drugs, surgery, and they do nothing nutritionally related. And if you look at the studies on fish oil, omega-3 fatty acids at the right dosages, which is 1,000 milligrams of active or more typically. If you look at B vitamins, magnesium, there's a lot of nutrients that can help with depression, a lot of nutrients that can help with mood and brain function. So I think it's just a tragedy that we're not taking better care of our soldiers nutritionally. Drug-induced deaths. This is actually reported and admitted to. So I'm sure it's a much higher number in reality. But even the reported deaths from drugs is number 9 now. The ninth leading cause of dying is from drugs now. The overdosages of heroin-related drugs, like Oxycontin, unbelievable. They've doubled and tripled the last few years. Doctors are handing out painkillers that are no better and no safer than heroin to their patients. They're getting them addicted. And then when they cut them off, what do? They turn to illicit drugs. They turn to street dealers. And it's a tragedy, and especially a tragedy when you consider the fact that we have turmeric. You know, we have high-dose fish oil. We have a lot of herbs and a lot of options from a natural perspective. We have chiropractic treatment options. There's so many massage. There's so many natural ways to treat pain without using toxic heroin-type pharmaceuticals. And it's amazing the FDA would approve these drugs. If that doesn't prove how inept and evil the FDA is, I don't know what does. Calcium. 20 years ago, I became a fan of magnesium, not calcium. The reason why is our diets provide adequate calcium in most examples, but they provide only a couple hundred milligrams of magnesium. They provide 800 to 1,300 milligrams of calcium. The books will tell you 2 parts calcium to 1 part magnesium. I think that's wrong. I think it should be 1 to 1. So when you adjust for diet, you don't want to give more supplemental calcium. You want to give magnesium. You want to give more vitamin D3, vitamin K1 and K2. And the reason you want to do this is the fact that without adequate D3, K1, K2, and magnesium, calcium stays in the arteries, in the blood, and calcifies the arteries. Have you heard of the class of drugs, calcium channel blockers? Well, they lower blood pressure by blocking the entry of calcium into the cells. Guess what? Magnesium does the same thing, but it does it safely. Vitamin D3, K1, K2 pull the calcium out of the blood and arteries into the bones where you want the calcium to go. Sadly, your typical multivitamin, the primary ingredient is the same ingredient used in concrete and cement, which is calcium carbonate. Why do they use it? Why do drug companies use the cheapest form of calcium and make it the primary ingredient in their multivitamins, like Centrum? Cost. It's under $1 a kilo, under $1 per 2.2 pounds. Some of the ingredients that I use for Maximize Living, like the methyl B12, thousands of dollars per kilo. So they don't put those in a Centrum. In fact, I don't think there's any ingredient in a Centrum that would be more than a few dollars a kilo. So it's about cost. It's about greed. And Dr. Ben and his team and JC and the science board, they've done a phenomenal job. They're like, Wayne, use the best ingredients. Use the standardized herbs. Copper, that's another one. Blows me away how the vitamin companies, even the ones sold at Whole Foods. Sorry about that slip up. Even the so-called health food store brands of vitamins still have copper in them. There's 5 studies, published studies now, linking copper to Alzheimer's. Those who have the highest copper in their blood and diet have higher rates of Alzheimer's, heart attacks, cancer, and mortality risk. In fact, if you're low on zinc and you have high copper, your risk of dying from all causes is 160%. Can you imagine that? And yet, go look at the labels of most of the vitamins on the market. They're loaded with copper. It's unbelievable. Okay, Maximize Living Foundation multivitamin. Dr. Ben and I had a long chat about formulating a quality 1 per day multivitamin for charity that your foundation is going to provide to people and patients that can't afford vitamins. And what we did is we created a product that's got magnesium without calcium. We can't put a lot of magnesium in one capsule, but we got 100 milligrams. Combine that with the diet, it helps. But very importantly, it's copper and calcium free. And we also put in up to 10 to 20 times higher levels of vitamin D3, the active form, compared to other multivitamins. Up to 50 times higher B vitamins, 2 to 3 times higher levels of zinc, selenium, and chromium. What I like about zinc is it protects you from excess copper, which we're getting out of our diet. We're getting too much copper, and the zinc protects you, just like the magnesium protects you from excess calcium. So very proud of this. It's in capsules, so it's easy to swallow, all natural. If you look at a Centrum and the store brand knockoffs of Centrum, there's up to 14 other ingredients that are chemicals that could be toxic that you don't want, that I do not allow in my building, that are not in our products, not in your products. Sugar fructose, I think we've already hit on it. Let me mention the diabetes. Type 2 diabetes is your easiest disease to reverse with a little bit of exercise, reducing the sugar, carbs in your diet. It's a very easy disease to reverse. Supplementing extra chromium is very beneficial. Also B vitamins, vitamin D3 of course, magnesium are very helpful, fish oil. The most important thing you can do for your patient is as they age, look at their blood glucose levels, fasting. It should be on the lower end of normal. I read one study where if your blood sugar is a fasting of 90, which is still normal, versus 60, your rates of mortality double, literally double from just in the normal range. So you got to watch the blood tests. The high end of normal may not be optimal, and that's the case with blood sugar. And if you want to age rapidly and develop a lot of diseases, induce elevated blood sugar. And we have a pandemic of diabetes. We have a pandemic of what's called metabolic syndrome, which is basically pre-diabetes. And that also includes inflammation. The most powerful thing you can do to fight inflammation as we age is turmeric. And you want the 95% standardized for C3 form. It's the patented 80 human studies. Turmeric's amazing. Fish oil, at least 1,000 milligrams of omega-3 EPA, DHA are incredible for fighting inflammation as we age. Gummy vitamins. It's funny, when I was talking to Dr. Ben, I misquoted. I said they were like 90 to 96% sugar and only, 10 to 4% active. And when I looked it up and did the math, it was actually worse. 98% sugar. This is a top seller at a mass retailer. 98% sugar, less than 2% actives. And just what we need, give kids more sugar. And that little 2% of actives is going to provide no benefit. And parents are feeding their kids gummy vitamins like they feed them candy, because they are candy. They taste good with all the sugar. And, it's just a total tragedy what we're doing to our children. Okay, Maximize Living. I guess it's been about, I want to say a year and a half ago, they started to convert all their products to where we handled the manufacturing, improved formulations. And then several months ago, they came to us and said, we'd like to launch a children's line and do a lot better than the other supplements that are currently on the market. And as a result, we've created, and they're in manufacturing, some are available now, a phenomenal line of products for children. There are powders and liquids and chewables, because, as you know, kids usually don't like to swallow pills. But they're vastly superior to the chewables and the gummies that most parents are feeding their children. They have primarily actives with a lot less sweeteners in them. They're all natural, phenomenal line of products. And as you saw in the video, and the prior wonderful doctor that introduced me, and the science board had toured the facility, they're made in a pharmaceutical grade facility. You know, the FDA GMPs, if you meet the minimum levels, it's not very good. We far exceed the FDA GMPs. We use HEPA filtration in manufacturing that's not required. We use lab testing equipment that's 10 times more accurate that's not required. We use Bosch encapsulators that are pharmaceutical grade. We use patented German bend blending solutions that pharmaceutical industry would typically use. I've never seen in nutraceutical industry. Where possible, we bought equipment from America. We also, 100% of our operations are here in America, not in Mexico, not in China. We've got to start supporting our American companies that are manufacturing in America because there's not many left. In fact, these shoes, I'm very proud of these shoes. See the Made in USA? The way I learned about these shoes is Steve Jobs was famous for wearing New Balance 992s when he did his annual Apple presentations. And I'm like, I got to check those shoes out. And I found they were discontinued. I'm like, oh no. And then I found out they had a new version, the 993s. And it's the last athletic shoe made in America. Can you believe that? Not one Nike, not one other brand makes any shoes in America anymore. And not all New Balances are made in America anymore. You got to check the model and see where it's made at. The 993 is made in the USA, and it's one example. I bought 10 pairs of them because one day I'm afraid they may not make them in America anymore. And so where you can, I know it's impossible to get a phone and a TV made in America anymore, but where possible, support companies that are creating American jobs, investing in American infrastructure and manufacturing. And I'd like to thank all of you and thank Maximize Living for helping us and working together as a team to make America healthier again. Thank you.